You want to get out of the
I do need to. I forgot what the color of my clothes.
Whatever you sub, I don't want to do. You know, it's gonna be 62 housewives.
In about a minute, we're gonna see some in about a minute, we're gonna see some pictures here. So after pictures, we'll come back to them and then we'll get started.
Drink more, drink more. That's what I love. That's how I make it simple and easy. I'm like, yo, it worked out. I love that. They don't see like I'm actually a person. So like, but my dress was kind of crazy. Like crazy dress. Like going to Miami tomorrow. I was like, I want to change the outfit, but I can't. I'm gonna be hot. I gotta figure this out. And I have a suit waiting for me. Just one piece of still pick it up. So mine is right, like my shoes, start first. Nowadays, now it's like my son. My son takes so much money now. Just turn. Most not.
Let's switch the view.
Still looks great.
Okay. I was just gonna say, I know that we need to turn it off when we start. I said no if it was on. I said no. Hey, smoke. Oh, you go over here. Really? Yeah. Yeah.
Good evening, everybody, and thanks for being here. We're excited to see you all. We started our campaign for the culture event back in 2019, and since then we've had many great conversations. Unfortunately, we've been stuck behind Zoom screens, so this is our first in-person event. So thank you all for being here. We know we have lots of people watching online. Thank you all for joining us online. So tonight we're going to have a very important conversation about Black men's health, and it couldn't have come at a better time. This is, of course, is Pride Month. This week is Men's Health Week, and of course, Monday is Juneteenth. So we're looking forward to having a very great conversation with some great panelists. It is my pleasure at this point to turn it over to our moderator, Dr. Quartey, to introduce them.
Hey, thank you, sir. Thank you very much. Good evening.
Good evening.
Come on, folks. We got to make sure the folks that are streaming can hear and feel the energy in the room. Hear and feel the energy in the room. And so, good evening, everybody.
Good evening.
If I could have this much energy coming off of a plane from Detroit, you all can have a whole lot more energy being right here in Washington, D.C. I am so delighted to be here among so many new friends and old friends, and particularly on this day. Particularly on this day. You know why I say this day? Today would have been my father's 73rd birthday. And when my friend Gustavo reached out to say, hey, would you be a part of something like this? I said, well, it sounds like a really wonderful way to pay tribute to my father, who died of an abdominal aortic aneurysm. My dad was a smoker. He smoked for pretty much all of my life, and had high blood pressure. Raise your hand in here if you know any black men that have high blood pressure. Keep your hand raised if you know any black men that smoke. We're going to leave it there as smoke, right? Well, those are a few things that can get in the way of us being able to live long lives. And I'm here because longevity matters. In fact, the work that I've had a chance to be a part of with the American Heart Association's Voices for Healthy Kids initiative. It was a national childhood obesity campaign. The work I had a chance to do on that, the work I had a chance to work on at AARP, across that spectrum, has helped me to understand very clearly that longevity for us is a justice issue. Longevity is a justice issue. And there's so many health issues and financial issues and public health issues at large that get in the way of us being able to live long and prosper. And so we have a distinguished panel here to help us unpack that. We're not going to spend time, just spouting off statistics and talking about what's not working, where things are inequitable. I mean, this room has a good grasp of that. We're going to talk about solutions. We're going to talk about insights. We're going to talk to leaders on the front lines, people that are in the arena doing the heavy lifting. When I'm not anchoring Foxhole's Black Report, I am moderating a show called A More Perfect Union on KBLA Talk 1580 in Los Angeles, the Tavis Smiley station. Hey, Tavis, I think he's watching right now. No pressure, panelists. And one of the wonderful things we get to do with that show is talk to change makers. People like you, people that are streaming in, that are in the arena, newsmakers, lawmakers, advocates, activists. And so we have a robust panel for you today. And I think you're going to enjoy it. The last thing I'll say is that I think love is in the details. And I just want to salute the team at Campaign for Tobacco-Free Kids for pouring a lot of love into the preparation for today. And we have a commitment from them. This isn't going to be a one-off conversation. This is a part of a series of conversations that we hope to have and we hope to spark across the country. How's that sound? Does that sound all right? Come on, energy. Does that sound all right? I'm coming off of that White House Juneteenth celebration earlier this week where we had church on the South Lawn. So does it feel all right? All right. Okay. With that, I want to welcome our panelists to come up. And I'm going to allow each of them to give just like a 60 to 90 minute introduction. 60 to 90 seconds. Did I say 60 to 90 minutes? No, not that. 60 to 90 seconds. So please come on up. Monroe Howard Shackelford, Reverend Whitney Castile, Jamal Watkins, Clinton Burnside, Dr. Otolorin. We had a good giggle earlier. Dr. Otolorin is Nigerian. I'm half Ghanaian, and so we were trading jollof rice recipe secrets. Guess who won that? Welcome, gentlemen. And so Do you want to lead us off with your self intro, your 60 to 90 seconds?
Thank you very much. Good afternoon or good evening to everyone. How y'all doing today? Good. Okay. My name is Monroe Howard Shackelford. I'm a native of Sacramento, California. Yes, there is a Northern California. It's not only Los Angeles. Because every time I tell people I'm from California, they're like, "Oh, how's LA? It's nice, but we good up top too." So, and I've been in the DMV area specifically. I live here in Washington D.C. For 2 years, coming here from New York. And I'm a therapist in private practice. I work in an all-Black private practice that is primarily based in Maryland, but I'm licensed to practice. I'm also in Virginia. I'm a part-time professor at Montgomery Community College out in Rockville, and then I do various consulting in lots of different fields, primarily also K-12 education, which was actually my first career. So this is my second career. I'm super excited to be a part of this conversation. My primary focus in my practice is the LGBTQIA plus population, Black LGBTQIA plus population. About 80% of the clients that I currently serve identify as Black, identify as men, and identify as gay. But I also work with Black trans clients and also individuals that may identify as non-gender conforming, non-binary, and also I think that's the scope of what I do. So yeah, thank you.
And before we let you go, you get to keep that mic because everybody can hear me just fine, right? I'm not ringing. Okay, good. I want to also ask you and the rest of our panel to share some insights, real briefly, about how health was discussed in your home growing up. You know, I mean, I'm the youngest of 5 boys, a lot of student athletes in my family, and there's a lot of attention to health, but primarily from the neck down, as opposed to the neck up. And so, can you share with us and the panel, please, weave that into your introduction?
Yeah. So I will say, first of all, I feel very privileged that my mother she worked for the state of California, so we actually had insurance. So there was access in my home, which is number one, which I cite as a privilege because we know, and in the communities that I currently serve and have served in my previous capacity, that is not the case. We're talking about uninsured and underinsured individuals. So in terms of the neck down, that was covered, right? It was normalized for me to go to the hospital and to, check those things and have my annual checkups and all of that. In terms of mental health, for me, in my home, it was usually in the context of spirituality, right? And so we'll talk about that, I'm sure, on this panel in terms of the intersection, because I grew up in the Black church. And even though my mother was not someone who was dogmatic in religious practice, she was a woman of faith, we really did center most of the mental health conversations around prayer and fasting and what God can do for you and what that power is do for you. And how that has evolved for me is, I'll just sum it up, I have Jesus and a therapist. So that's where it's at today.
That's the real JT. All right, Dr. Otelore, welcome. We won't say anything else about you.
All right, I would not. Tough act to follow. That's fantastic. So my name is Dr. Otelore. I'm here with my lovely wife, Otelore, and it's a privilege and an honor to be here on this very important day to discuss a very important subject. So I'm a family physician at Howard University, right here in Washington, D.C. And I'm also, by way of background, a computer scientist and a bioengineer. I was fortunate to study at Georgia Tech when I came to America. So as Dr. Quartey rightly stated, I moved to America in 2000. I spent the first 18 years of my life in Nigeria. And as you can imagine, there are challenges there as well. However, for full disclosure, I was really one of the fortunate ones. I grew up in a household of physicians. Both parents are physicians. My grandfather is also a physician. I have a sister who is a physician. So my experience of healthcare is not typical. That's just being honest with you. That we did speak about health. We did have routine preventive care with primary care physicians and the likes. However, in regards to mental health, we're in a society where there is some stigma. And even though there are public health measures on the way to help raise awareness and reverse that, but it's not something that is often discussed. just being frank with you. And upbringing, I was again fairly fortunate. So coming to the States, got to learn several new things to me. Quite frankly, growing up in Nigeria, I wasn't really very knowledgeable about the challenges with civil rights in America and some of the prevalent racial and ethnic disparities. And so coming over here during my college days, grad school, was a lot of learning. I remember my first I Have a Dream speech, and that was, wow, really? All those things are happening? So that was very educational for me. I was fortunate to have a visit to First Baptist Church in Atlanta, and Ebenezer Baptist Church, and very thankful for that. One of yes. It was the minister that day, and I got to meet him that day. So my journey to America, and also one of which over my time here, I've got to learn challenges, and fortunately, I got to study medicine here at Eastern Virginia Medical School, Norfolk, Virginia, and obviously I'm looking to Howard University. Thankful to be here. I look forward to discussing. Thank you.
Great to have you here, and all the folks from Norfolk, Virginia that are streaming. Okay. Okay. Next up, we have a friend in the movement. I've known for many years. He is a fierce advocate. He is an effective activist. Paul Watkins, the NAACP. Tell the people who you are.
It sounds like I need to give you a check. Well, good evening, everyone. Paul Watkins with the NAACP, America's longest civil rights institution, 14 years old. For some folks, they're like, oh, it ain't relevant. But for folks who are in the know, we are a $100 million a year powerhouse that moves the most direct border contact in the Black community outside of Canada and campaigns. And we exist in all corners of the United States, as well as Japan, Korea, Germany, and places where we have military outposts. So we're present. Doesn't mean we're always effective in every place we're there. And so what I wanted to lift up, I feel from the state of California, and the irony is both of my parents worked in the state of California, so they were part of the union, SEIU, Service Employees International Union. So we had health insurance. And so when I think about my earliest on having health insurance, I remember I was about 8 years old, and my mother was like, we gotta go to the office. And they're going to teach us about nutrition and mental health, all this. And I was like, I don't want to go. She said, no, we got it. And I was like, I don't want to go. She said, they're giving us $250 gift card to Safeway, so we go. And when I realized that moment, the irony was that health is actually literally, and that there's an economic driver we see as the healthcare industry. So when I think about health and well-being, even from my early days, knowing that my parents had good childcare, taking that for granted that we had health insurance, an insurance provider that was able to take classes to be healthy. Most folks in our community don't have that. And so when I reflect on it, it really does really put a fine line in terms of what we're debating about in this country today.
Let me just add, double click away from relevant. I'm not just saying that to you. When I saw your president, Derek Johnson, the White House earlier this week, I said that to him. In my lifetime, our lifetime, to really step up in a dynamic way. I mean, we're talking about reparations, we're talking about student debt cancellation, we're talking about debt ceiling, and the winners in our community, and the way CP is right there. So we appreciate that you're right here with us. Give them all a hand. Moving down the line, Mr. Ritney, by all means.
Thank you so much, and good evening to everybody. First, let me start by congratulating the Campaign for Tobacco Free Kids for well over a quarter of a century of incredible work in space. I know that I can certainly relate to and appreciate the fact that there is a newfound urgency in elevating conversations as it relates to Black people. but certainly Black men. And here is my new shape that I'm excited to see that for the first time in this organization's history, it's being led by a brilliant Black woman. And I'm very excited.
Stand up, stand up, stand up, stand up.
Come on, Yolanda, let the people see you. Thank you so much. And actually, a number of years ago, really had an opportunity to exercise in the professional field in public health while working with faculty kids from 2011 to probably 2014, 15. So, you know, I'm also a pastor. I'm an ordained Methodist A&E elder in our denomination life, and I pastor a church in Jersey City. And so my work in public health as well as the pastorate is very similar to me. Sometimes my job in helping people is about preaching the sermon or leading a congregation to action. Other times it's about calling up and calling out individuals and systems that are some way blocking folks, particularly Black and brown folks, from living their best lives. So, you know, I am really excited to be part of this conversation today, particularly with all of these esteemed gentlemen, this esteemed panel, and I look forward to being able to chat with you a little bit more about my work and how I see that help today.
Sure, thank you, sir. And Monroe Howard Shackelford. Welcome. Oh, I'm sorry. I'm sorry, Mr. Clinton Burns. Please.
Hello, everyone, and thank you for having me first and foremost. I'm excited to be here again with this distinguished panel. Listening to the introduction, wait a minute, am I in the right place? You know, I don't know if I truly belong here, but nonetheless, I'm here, so I'm excited. And so, just a little about myself. You know, I'm actually from South Carolina, very small town here, and you know, growing up for me, it was quite interesting because both my parents they worked in factories. So yeah, and we had insurance, but at the same time, we really didn't use the healthcare system that often. Not because it wasn't available necessarily, but our lives were so busy. You know, and then with my parents, they worked 4 hours, 5 or 6 days a week, and so health was never really at the top of our list to discuss. Neck above or neck below, in addition. But I think the true advantage was that my mother parents owned the farm. So that's what kept us very, very active in terms of eating good food, you know, healthy foods, and just being very active. So we really didn't have to go to the doctor. Before we started, I'm excited to say, and I'm almost hesitant to say it because I don't want to jinx myself. I've never had a broken bone in my body. So, I mean, and I think that's really rare nowadays. I'm actually the third or fourth boys in my home, and I can't say that for my brothers, but at least for me, you know, that was the extent. And again, health was really never truly discussed. You know, our main interactions we had with the healthcare system was really always. So every year we got a physical exam, and you know that was so very generic. It was okay, open your mouth, move your tongue. Okay, now drop your pants. You know, and that was pretty much it. And so I really didn't have my true experience in terms of healthcare. And that's kind of left South Carolina or in North Carolina for college. And so from there, you know, things kind of changed for me. Not that I wasn't healthy, but again, you know, just never the list. But then I met my wife, who's actually watching tonight. So thank you, my dear. Just a shout out to Angela. So now I have a place to go home. But so when I met her, she's actually from this year. So that's what landed up here. So no, this is really for me. So we came up here. And that's when I kind of got involved with clinical trial research. But then I landed a position over at Howard. And that's where it really started for me in terms of being or having more interest in health. So right now, I'm currently managing our men's health program at Howard, but specifically a program called Men's Health, in which we're out into the community to bring more awareness, not just to cancer, but men's health overall. Now, we do have a specific focus in prostate health, but I tell men all the time, yes, prostate is important, but we're more than just prostate. So That's truly my focus and the excitement that I'm here to. I'm excited to be excited to kind of share more about the work that we do and how excited I am to be a part of this panel to share some other opportunities.
Well, thank you. Let's give the panel a hand. I don't know about y'all, but part of what I'm so taken by is just so many elements to the conversation, right? And so you just talked about, that annual physical. You're gonna play sports. You get your physical and bring your paperwork. And for a lot of us, that is motivation that we talk about doing about our health. Dr. Lauren here, you're sort of an outlier. Being come from a family position, and so a lot of this conversation, but I want to go back to the conversation of health from the neck up connecting. We are a very diverse community. Black folks are not a model. Right? The diaspora is represented in this conversation. And so, Monroe, I'm going to start with you. Considering that there's such a range of identities in our community, talk about the role that mental health plays in the overall well-being of Black men, and if you could share some effective approaches to addressing some of the mental disparities, particularly Black men. What are some encouraging therapies or approaches that we should work?
So, the thing that I am extremely passionate about to make sure that is infused in any conversation that we have, because as you stated, you're not a model. As an individual, there is more to you than just what you may be able to see from the outside, as you may assume as being male, assume as gender identity as man, and as Black, right? These are typically the identities that are most salient in the room before you even open your mouth. And people make judgments or have ideas about who they are, and it limits individuals in actually being who they are, right? So when we talk about intersectionality, there are a lot of different meeting points in terms of socioeconomic status. There's meeting points in the gender identity, sexual orientation, right? When we're talking about faith and religion, like all of these things are things that intersect to make us who we are. So we start off the conversation by stating that allowing an individual to actually express, to explore who they are is probably one of the greatest things that we can do to promote mental health in our community, particularly around Black men. Creating spaces where there is not an attack on masculinity or sexual orientation, but it is an open space where people can actually talk about who they are or who they think they might be, right? So when we're talking about a lot of these disparities, a lot of the barriers are perceptions that coming into spaces, one, means that something is wrong, or that I'm broken, or that I am damaged, right? Or that I am weak, particularly for men. So if we're doing things to actually destigmatize and actually demystify what this process can look like, allow men to really kind of open up, that is the portal and the gateway for an individual to really start to explore how they feel, to start to explore how something has impacted them, to start to explore ways in which they can process things in a healthier way, ways in which they may be able to cope with things in a healthier way. That is something that I promote all the time, because we hear rhetoric, we hear all of these things in terms of certain agendas, this agenda, that agenda. But when we are talking about human beings, and as Black men, we are often relegated to two very similar identities, which then has us fit in one box. If we don't fit in that box, that can be a myriad of mental health challenges when we can't reconcile what people expect of us and what we actually really feel on the inside.
Part of what I hear you saying is that, this is me just summarizing it, toxic masculinity can be a major challenge when it comes to our mental health. And just as you were talking, I was thinking about the stories that we've heard about in the news. Michael Jordan and Jonathan Major, how that got reported in the news. They were very affectionate with each very, very affirming of one another, and they're folks kind of shoulder to shoulder. You know, we have, like, no, we can be affirming of one another. And that doesn't have anything to do with sexual orientation and gender identity. Very similar in the news, the brother that's fighting right? I think he can be a really wonderful post on Instagram that's gone viral, where he's getting at this idea of practicing radical imagination in terms of how we can show up in the world without, judging people or prejudging people. And so, riffing off of that, Dr. Lauren, can you delve into some other key factors aside from and toxic masculinity? Key factors driving higher rates of chronic disease, talking about hypertension, like my father, diabetes, like our brother, prostate cancer, among Black men. What strategies are we implementing to make a difference for Black men at this point?
So, chronic disease is a major epidemic, not just in the United States, but globally. We've seen an increase in diabetes, conditions, incidence, and prevalence as well. For Black men, in fact, Black people in particular, it's more challenging because we have a lot more barriers to care. Barriers to limited care, barriers to screening. How do you get that attention? You need to get screened. You need blood pressure check. How do you get your blood pressure? You need to access the facility, or you have to have someone who knows, who discusses with you, advice to complete the check. In fact, you need to be aware that there is such a thing as hypertension. If you're unaware about it, you wouldn't be aware about it. It doesn't trust me, just look at it. These are some of the barriers. Health literacy. How do I ensure that people know about these conditions and are sensitive enough to know when to get screened? They're prompted. Do they have this message then based on your age or some other risk factors that you have to prompt you to get screened? And then you get screened and screen positive and you get treatment. You afford it and you actually control your blood pressure over time. Not just sporadically. You change your job, insurance changes, you lose your job, you lose your insurance, and you afford your medications. The major barriers. Granted, there have been some public health policies that have changed things better. We have to give credit to the President Obama, his portrait here, and the President Biden as well. They are making some effort. However, is it adequate right now? The numbers say no. We have to do a lot more. So I'll go back to number one: screening, education, health literacy. If you think about health, there are many determinants of health. We have social determinants of health, we have the environmental determinants of health. For example, where you live, how much there, parks there, and you actually go for a walk or go for a jog safely and feel comfortable to do that spontaneously. Let me just go for a quick run. And you access a grocery store to buy fresh produce. These are major determinants of health. That's taking aside genetic predisposition because some individuals do have it. But if we can improve social determinants of health, help people have access to the local grocery store with fresh produce at an affordable price, not it's
That whole paycheck. Y'all know what I'm talking about.
So we need to address a lot of systemic issues and things will be improved. Oh, there's one major one I haven't. How do you access a physician who you are comfortable with? Major challenge. Right now, there is severe underrepresentation of Black physicians, especially Black male physicians. Just numbers with you. Last year, 2022, there were only 671 Black male medical students admitted to medical school in America. 6, 7 out of over 20,000. That's a major, major problem. Major, major problem. And why is all these factors on this education, opportunity, financing, funding, even mentorship, someone to guide them towards that, someone to say, hey, you can do it, hang in there. Yes, you're going to go many more years for having a major patient, hang in there. How do you make medical school affordable? You know, how do you provide scholarships? You mentioned $100 million. Can you give us 50%? 50% of that, that would be free ride to lots of folks.
Very interesting. Very interesting. We're days away from the U.S. Supreme Court issuing a major ruling on affirmative action that will have a huge, huge impact on Black folks' ability to get into all medical schools. We know that HBCUs overperform in terms of Black medical students, getting Black medical students, matriculating. I want to go to Jamal Watkins of the NAACP. Dr. O'Loren invoked former President Obama, which we would have the Affordable Care Act, had it not been, for his vision and his work, and all the work and so many others that are on the ground to make it so. How can community organizations, grassroots initiatives contribute to reducing health disparities, particularly among Black men? And what support do these organizations need to be successful? I have a budget like the NAACP. And so, Willis Edwards, former NAACP, national board member, mentor to so many of us, do what you can.
Well, I want to start off with sort of a journey. You heard some of us introduce ourselves and talk about where we're from. Yell out where you're from. City, Jackson, Mississippi. Hey, Jackson. Anybody else? Louisiana? Jackson, Mississippi. When we think about the notion of place, one of the things that we have found in our research is that place matters even when it comes to health and well-being. I'm from a city called Bakersfield. Anybody know anything about Bakersfield? Kevin McCarthy is our congressman. We didn't vote for him, nonpartisan, not blind, but when you think about place, what we find is that, to your question, we have to actually dig out, what does it mean to place health and well-being? So last year we launched a tool called the Black Progress Index. If you take out your phone and Google Black Progress Index, which is powered by the Brookings Institute and NAACP, Dr. Andre Perry and a team that includes some brilliant minds started to look at what is actually affecting your mortality as a Black person based upon where you live. And what we found was that out of the top 200 things that impact health and well-being, there's about 13 that actually shot off the charts. And some of those things are not intuitive. Some of those things we wouldn't say, wait a minute, that actually affects my mortality, if you will. So for example, if you were born in the United States as a Black man, everywhere, your mortality is lower in comparison to foreign-born African Americans, if you will. If you are distant from friends, I don't know if you all are very social beings, but your proximity to friends can affect your mortality. If you live in a community that has little home ownership rights, it's one of the primary indicators that the community is not healthy and the mortality of that community shoots down. And I heard you say Jackson, Mississippi, that's where my president and CEO lives. The numbers are dismal in some of the counties in Mississippi, because those factors that we think about aren't the normal factors. The stress that happens above the neck, if you will, when you think about the economics of life. And so when we're talking about community groups organizing and activating, how do you speak to people basically where they live, where they're from, and what it means to connect dots? It can't be some often thing that we're fighting on this in the Hill here in DC. What does it mean in Jackson, Mississippi? What does it mean in Los Angeles? What does it mean to say in your community? What are those factors that are impacting literally your life? from your family, and then that's how you connect dots. Of course, there's this notion of how do we leverage the part of the network, because in many ways, a lot of the solutions are not revolutionary. How do people have a good job? You touched on life insurance, health insurance, having folks have green access, meaning access to parks and recreation. Some of those things aren't literally rocket science. It makes the difference in terms of whether you live a long, healthy life or not. So I would argue that is where we want students to connect in a hyper-local way to what is real for folks, and to make it not something that's policy launch, but about their daily lived experiences. So when we talk about things that go, okay, we talk about the things that are on our ability to live long and prosper. Is it really clear to you, like, what are those things? It's not abstract. These are very concrete examples of the things that drag on, Black folks, particularly Black men, being able to live long and prosper. I want to go to Reverend Ricky, and I want you to share with us what role do faith communities play in supporting, advancing, and if you could share one example of a faith-based organization or a church that created a model that is accelerating change with the church. I think the captive audience loves it.
Thank you. You can feel free to call me Ricky, because in a moment I will exchange my ice water for a bullet person. Or at least champagne.
We told you, real conversation, unscripted.
So,
Free kids after hours.
So one of the things that I'm very comfortable saying is that in spite of increased secularism as well as skepticism, that the church, religious institutions still are quite relevant, we use that word a few times, particularly in the African American community. And many faith traditions, many, not just Christianity that I subscribe to, but many faith traditions not only talk about those things that are scriptural or traditional, but they also deal with those things that underscore more holistic well-being, like promoting healthier eating, de-stressing themselves, exercise, other nutritionist things by bringing in seminars or speakers, or even artfully incorporating those things into sermons and programs. Just this morning, I held a 7 a.m. prayer call with my congregation as well as others who wanted to join via council. One of the things that I expressed on the prayer call this morning is that would it be a shame that the only way you can access heaven is to die? I'm a proponent that we ought to be able to experience a little of that while we are in life, right? And so one of the ways that we are able to do that is by all of the things that these gentlemen have already said, making sure that we're in tune with our health, making sure that we are eating right, sleeping right, getting folks out of our space who have no business being out of space, and all of that good stuff, right? To contribute to our own version of heaven on earth. And so, for many faith groups, we don't just talk about it, but we have to be about it. I think generationally, right? You're a doctor, and I can appreciate that. For my grandmother's generation, she would likely listen more to the pastor than she does to the doctor, right? And so if old Rev says, you need to stop eating what you're eating, or you need to become more physically active, that's a wake-up call in a way that sometimes does not resonate even with public health professionals who are licensed in college, the work that they do. And so faith leaders know that. And there's an added burden, and I'll get to the last piece of what you mentioned, but there's an added burden within Black faith prophetic traditions, to where those of us who are pastors or preachers, prophets, whatever, we don't have the luxury of being weekend warriors, where we can say a few things on Sunday and relax in our homes every other day of the week. Throughout history, NAACP certainly as well, that faith leaders, pastors, and others, their job also includes fighting for policy and equitable and more just things to make sure that people ultimately are able to live their best life. So that's really what my worldview is. That's what I fight for. Now, to speak to just a bit of organizations that and even churches that do that well.
Just one.
It's hard. But the preacher got the mic. So I will note that I'm very proud of the work is secular in nature. It does partner with many of the mainline denominations that are both Christian and otherwise to sort of infiltrate their system, do learnings, as well as to promote positive health messaging as well. So I'll leave it at that.
We appreciate that, Reverend Mr. Gill, we appreciate you. I want to go back to the Men Take 10 program over at Howard. You teased it a little bit. We want to dig a little bit deeper. How can we enhance health education? There's a lot of folks out there doing health education, maybe not as effectively or as efficiently as Men Take 10. People out there doing it. How can we enhance health education and health literacy among Black men so that we feel empowered? It's not something that's being, forced on us, but it's something. It's a tool in our toolbox, a set of tools in the toolbox that we feel comfortable applying ourselves, learning from people that look like us, from where we come from. And so, dig a little bit deeper about Men Take 10 and talk about health literacy.
Okay. Well, that's an excellent question. I have honestly, a two-word response: community engagement. Now, I need to go a little deeper than just community because and it's different, right? So I think one of the main things to go to the community, we can't just sit back and look at publications and reports and say, well, this is what I mean, because these, we see this, so we need to bring these programs to this area. That doesn't work. We have to on the ground. We have to go into the community and engage them. And when I say engagement, it doesn't mean, hey, I'm here, I'm wearing a nice Howard shirt, so hey, everybody should come over to me and hear what I have to say. No, that's not what it means. And I have to say that I'm very passionate about this because this is my experience and what I've done. Because when I started in this work, that was kind of the mentality. Okay, I work with Howard. This is the great institution. Everybody knows Howard. So if I go to any community, people are going to come over to me and say, hey, let me learn something from Howard. But that's not the case. We have to go into these communities and build relationships. And relationship doesn't mean I'm going to bring this program with X amount of dollars and just plop it here, and then I'll be here for a year, and when this program is over, I leave. It doesn't look like that. It should not look like that. But we have to meet them very well, right? And so we've talked about, been mentioned in the panel, understand what are the needs in the community. Yes, we see what the numbers say, but let me talk with someone who lives in that community, who wakes up in that community every day, who goes to sleep in that community every day, who goes to school, who goes to work, who's in that community every day. That's who we need to talk to. And not just talk to them, we have to involve them in the conversation, right? So when we're at the table making these discussions, trying to write these grants to get a program funded, we need to have them at the table as well, so that we can understand exactly what the needs are. In fact, I had a conversation with a gentleman not a few weeks ago, and he's one of my colleagues in terms of community outreach and engagement. And so he tells me that he goes out to an event, and it's very hot, first of all, oftentimes, so we're not exactly comfortable, but we do this, not because we enjoy it so much, we're passionate about it, but it's the impact that we have in the community. For people to come up to us and say, well, what do we have at the table? It's not about what we have at our table. What do you need? How can I help you? Now, if it means get you a job, well, I can't give you a job, but I can connect you with a resource that can help you with it. The other piece, give us some education. Meet them where they are and find out what do they know about blood pressure, high blood pressure, low blood pressure. Find out what it is that they know, and then meet there and then get to a place where they can better understand it, and not just understand it, but then connect it to them. Because most of us, I think you started a conversation earlier about If you know someone with high blood pressure, raise your hand. High blood pressure and smoke, raise your hand. That's where we have to meet people. And just a quick story, with another experience when I started in this type of work. I was actually on assignment in Baltimore, where I worked with a youth organization to help them to understand the harms of tobacco. And we had this great campaign, and I met with them and said, okay, this is the harm you're doing by smoking cigarettes. And it blew my mind that I spoke with a youth. I think he was sat there and let me go through the speech, and he just kind of started violating, really interested in what I was saying. So I said, okay, so now you heard my speech. What do you think? He looked at me and he said, Mr. I can care less what tobacco is later on. When I'm concerned with what I'm going to eat tonight, where am I going to sleep tonight? Am I going to live through the night? So that changed my mind, and that's what helped me to better understand. It's not about sitting in your office and yes, we can do that, but we have to be speaking where they are, and not just speaking where they are, but speak in a language that they understand.
This conversation is being billed as going beyond the barbershop. And so for the folks that are streaming, for the folks in the room, for what is in the secret sauce in terms of that what creates an environment, what co-creates that environment in the barbershop that allows for a level of care, for a level of vulnerability, for a level of exchange that isn't so easy in every environment.
Again, I think it's really the connection. You build relationships. In the barbershop, you can walk into a barbershop, but most people you're familiar with the people in the barbershop. So that's what makes it really make a connection and be a part of the conversation. And that's what we have to do in the community. We can't just show up one day and think it's going to change overnight. We have to continue to be in those communities and build those connections. And it takes time. I think the challenge is that oftentimes we have these programs, but the program is only a year or two, or maybe even 5 years. But then what happens after? We can't abandon it. We have to continue to build those relationships. And I think that's the key, building relationships and letting them know that, you know what, I may not have all the answers, but if the answers that I don't have, I connect you with someone who may have more information that you're looking for.
Yes. I don't want to take advantage or to assume that these community institutions are safe for all Black men, because they're not. Because actually, that's part of the accountability that institutions like the church, institutions like the barbershop have to actually be accountable to, because these are actually spaces for some of us that have perpetuated harm and trauma, right? So these are the conversations also that need to be had to say it's not a safe space for everyone. It's not a safe space for everyone to be vulnerable or to be open, because there is emotional and at times physical threats, right? So I think it's important in terms of really kind of having that community listen to the wide variety of experiences of Black men, because it's not everywhere for all of us.
Calling the question around who do you listen to? And I'm not saying that like to be rhetorical, but right now, if you had to write down your top 5 people, if they called you or if they're on the news or if they're saying something, not only are you going to listen to them, you're going to actually respond positively to what they're saying. And I'm saying that because when you're talking about health with Black men and Black women and families, I had to ask my daddy, like, who do you listen to? And he was like, well, I like Charles Barkley. I said, son, that's what we doing? And he said, well, I listened to some guy named, what's his name on the news? I said, what do you do? He was like, Lester. I said, Lester Holt? I said, okay, try to. But I mean, I like Lester Holt a little bit. But the point is, I think some of the conversations have to be very pragmatic. And even if you start with yourself, who do you listen to? Who are you taking advice from? Who are you taking guidance from? Because 9 times out of 10, you start talking to folks, you get fascinated who people are listening to and who they're following. And that's a way to kickstart the conversation around the therefore what when it comes to things like health and well-being. Come on, the group text
sometimes beats breaking news, right? So who's in your group text, right? I mean, this is not complicated, right? Now we were listening to Dr. I want to bring you back into the conversation. And I want to zero in on tobacco. Right here, campaign for tobacco-free kids. I shared earlier, probably 73 years old today. Smoked for a long time. Diabetes, so we have abdominal aortic aneurysm. And so, my dad is not. There are plenty of Black individuals in the U.S. who have experienced disproportionate adverse health consequences related. So, can you speak to the medical conditions related to tobacco, specifically overuse of tobacco, and how this impacts not only people, folks around you? There's so many stories of people I never smoked. I got lung cancer. How did that happen? Right? And so, can you
First off, regardless of which prophet peace, give you respect. Smoking causes many problems, many medical conditions that include the history of smoking. The most common one, which most people are aware of, lung cancer. Thankfully, through legislation, policies, cigarette is one in age is going to lead to lung cancer. But beyond that, there's many kinds of cancer, bladder cancer, gastric cancer, you name it. It's a major risk factor for most of them. And also the condition we call COPD, chronic obstructive pulmonary disease, really bad condition because a lot of people who have this suffer, and that's one of the fortunate. What I mean by suffer, difficulty to breathe, they struggle to breathe. And when it gets severe, they have low oxygen in their bodies. They now need oxygen supplementation. Have to move around with oxygen tank. Very difficult life, having to, for example, the experience of going to the grocery store is now more complicated. Now they have to take on their tank. If it runs out, they're in trouble. Then they have to go to the ED for care. Then they have frequent hospitalizations. And of course, all that is expensive, not just for patients, but for their families as well. How do they afford the medication is very expensive. Some companies have drug programs to lower the price, but still it's expensive. So it has an economic effect on patients and their families as well. Now, you mentioned concern for people who are around smokers. Yes, secondhand smoke is a great risk for anyone to develop COPD and all these other conditions I've mentioned as well. Just because your smoking does not isolate you from your family, especially young children at home. You already have a high risk of asthma. So if you're smoking around children, it's for lung disease. And part of the challenge we have with medicine is that a lot of major conditions manifest over time. So it's difficult sometimes to communicate to someone that, hey, what you're doing is harmful to you. Because today, they feel fine. They feel fine. They don't have any symptoms. But what I'm telling you could lead to major problems 5 years, 10 years down the road. So it's difficult for them to accept the cause and effect. How much more for a loved one, wife, husband, children in the household. So part of what we have to do is everyone involved in public health is to continually reinforce the risk, understand why people continue to smoke, in a respectful manner. Because one of the things that I have to make as a clinician is that when people make these decisions, they have a reason. And you have to actually show them that respect that. I want to why are you still smoking? This is why I can't get it. Right now I'm homeless. Or dog, no, I'm very depressed. This is what's going on. People do these things for a variety of reasons. And if you can engage them in a respectful manner, come up with a plan to partner with them, share decision making that, hey, I understand you're going through this. What's your plan for getting a job? How are you going to resolve that issue? having resolved that and worked for, are you ready to quit? What can I do to help you? What are you open to? Some medications? Are you open to the fact? What can you afford? Okay, granted, there are some programs that make some of the medications available at no cost, but over the long run, we have some funds to support this stuff. So, managing tobacco cessation is requires comprehensive care, and is something that we are endeavored to do.
Compassion, clap for that. Clap for that. The compassion that you brought to your response there. And just as a follow-up, this question just occurred to me, and I'm sure people that are streaming folks in the room. What distinction do you make between tobacco use versus smoking marijuana versus hookah, right? You know, like as a physician, are you saying, hey folks, like smoking period has a harmful effect over time, or is some smoking not as bad as other smoking?
Thank you very much for that very loaded question. So, a couple of things. First of all, I try to ensure that my patients know that when they're with me, it's a safe space. I respect their confidentiality. I want them to feel free to disclose to me whether they smoke or not and what they smoke. Very, very important. Whatever you tell me before the exam room is confidential, and ask me so you know that you're comfortable discussing with me. My reaction to that is such that you can continue. I never want to react in a way in which you stop me. No, I don't want to engage this physician. I don't want to talk about this. You know, he's not going to understand. That's it. So when it comes to marijuana, number one, I want to know that that patient does that. Okay. And then I have to understand why. And also, how often, for how long, okay, and understand what is it about it that you enjoy or you find most fulfilling. Now, the truth of the matter, at the end of it, always what I believe is really best for their health is smoke, inhalation of substances now or in the future. And also, there are some complications to marijuana use. One of them, there's controversy, and there's some decline of function. Again, most chronic conditions, you don't experience it right away, but over time there is. However, I respect for people who say, in spite of that, I enjoy it. Look, this is what keeps me calm. This is what keeps me going. I will not be an impediment to that. Thankfully, the laws in DC have made it such that some things are legal. So I cannot even bring it up now. It's illegal, reason why you shouldn't do this. So I remain respectful of people's choices. But as a clinician, I have to, just like smoking, every encounter, every visit, we raise the issue. You're still smoking. So I've cut down from one pack a day, I'm now doing 2 cigarettes a day. Made progress, awesome, fantastic. I'm great at that. Keep going. Same thing, marijuana. Are you still using marijuana? Yes, I am. No problem. I respect you. Okay. So again, you want to keep the relationship cordial, and that's what.
Well, appreciate it. We're going to keep it real. We're going beyond the barbershop. So I had to ask that question as it just popped in my head. I want to zero in on some policy. Jamal, I think you might have a point of view that people want to hear. The FDA has issued, I just learned this. So we're learning. The FDA has issued a proposed rule to ban the sale of menthol cigarettes. A recent analysis by researchers at the Council found that a ban on menthol cigarettes can eliminate the disparity in lung cancer deaths between Black Americans within 5 years, 25 years sooner than it would otherwise happen. We know that in 2016, the to pass a national resolution urging the elimination of menthol cigarettes. What is the social health impact of NAACP's stance? And what can we do to sort of step up our advocacy? Because here we are talking about longevity issue. It seems like this might be a way for us to gain some years, especially considering that the pandemic is taking away more years.
I would argue part of what makes this challenging, and the doctor, I think, messed up some folks because he said stuff. I'm gonna say it again. He said stuff. He implied you could eat it, but that's what I heard. So when you think about it, let's talk about it. So when you think about cigarettes and the menthol that's in cigarettes, the data is clear that it's killing us and it's causing a disparity. That's not a sexy or exciting topic, and that's not the topic that you want to tell the big mama when she's out on her Virginia. At the end of the day, I think what we're really talking about is how do you bring people back to the fact that most folks want to live a long life, and you want to live a good life. And if this thing that got you hooked up is causing you to have not a long, healthy life, how do we actually get that out of you, if you will? And that's the struggle, I think, that we have to bridge between the policy, the data, the analytics with people's lived experiences. When you think about culture of health, they say that the big three is genetics, control that, behavior, and environment. And so if we're not changing behaviors, can we change the environment? If we don't make it available. Now, I don't know if Big Mama going to be running around trying to find menthol is banned, but likely not, or at least it's successful. So I think we inside of my organization, having those conversations, let's connect the policy to the environment so that at least we can helpfully and hopefully steer people in the right behavior path, i.e., eat it, don't smoke it. So when we think about that framework, it's the notion of having those conversations, doing it in a way that actually not demonizing the behavior of the people.
Well, this is a follow-up, and so the tobacco industry is trying to prevent this move from reality. Folks out there, there are folks out there that say that they have been peddling false claims and banning menthol subject Black Americans to more law abuse. There's the NAACP letter that said last year that the claims are without merit and must be rejected. What are your thoughts on the industry's use of this argument that is creating some tension, some minority misinformation in the Black community?
I don't know of any Black man or woman who got pulled over because they had a menthol cigarette. I don't believe that that is what drives racism. And on that actually be the trigger. Eric Carter was killed. He could have been selling cupcakes. He could have been selling shops. It's literally over policing that's the problem. As effects of over policing, it's not actually a ban on that. It doesn't make sense. So when the industry is using that as a stereotype, I actually, and we as an organization, we're now using some racialized things that aren't true. Anybody or father sit down with the kids and say, I did an menthol cigarette, hide it, because the police don't come back. That is not what the situation is in our community. So I think in many ways, it's a scare tactic, it's disingenuous, and it actually should tell folks, wait a minute, if they're willing to go that far to spin that type of narrative, then there actually is something wrong, and somebody over there is making a whole lot of money off of our family. And so how do you actually get into that conversation? Because if you want to stop over policing, I would dare the traditional tobacco industry to put a whole lot of money on anti-police. Actually put your money to fight issues that we're facing in our community. Because then I would see you as an ally as opposed to trying to scare us into saying, let's just keep smoking menthol cigarettes that's disease disproportionately killing us. Doesn't make sense.
All right. Mic ish to me. Well, let me, I want to ask you about liquor stores, presence of liquor stores, retailers, and presence of tobacco retailers. Talk to us about how their very presence affects sense of empowerment and control that Black men. We know that sometimes the healthy choices, but we still dig the convenience that liquor stores. So,
Man, I think you I think it's about convenience. If you have an individual who to walk a half block and you can encounter 2 or 3 liquor stores that sell tobacco products versus healthy food options. I mean, and you've got a limited, then your choices are going to be very limited. That's pretty much what it is. When you give, and when individuals are attached to the education piece, they're up. I think they'll make better choices. I think prime example, if we were to issue everyone a $25 gift card, say you have to spend on food. Well, depending on where you live, that's right? But so it goes back to what we've been talking about earlier. The environment plays a huge role. And so it's close, if you walk out to 3 or 4 liquor stores that are right there, it's almost impossible to say, okay, well, I'm not going to support this business at all. So you may not go in and buy alcohol or tobacco, but at some point you're going to support them in some way. And then your friends, your people around you, it's almost impossible that they're not going to support those parts. So eventually, you probably will in some form. Like we talked about earlier, you may not smoke it, right? So it's really important. And I think this isn't unique to a particular area. It's an area of people of color, right? Because when you go around the country, you see some of the similar patterns, right? There's liquor stores or tobacco products being sold on a lot of the corners in some of the minority populations, some of the others, in some of the suburbs, I would say. So that there's no way we can, right? So that has a meaning, and the meaning is that it impacts at an individual. And so I think the way to address that is if we not necessarily eliminate the choices, but if we help them to understand what they're up against, they're able to make better choices. You know what? With the gift card, a half block down this convenience store, I'll get on the bus and go a little further and go to the grocery store.
remember, we can connect the dots for a bit. And let me just say, we are just over 3 years the merger and Ahmad are and to name. And there is this avalanche of support from corporate America, from organizations, and fight racial justice. Fight. We're going to pour money into the water analysis, billions of dollars in commitments that were made. Most of them still today unrealized. Can you talk to us about the relationship of tobacco? For instance, that today tobacco-related diseases are still for one cause of death in our community. Connect the dots to how tobacco use is a racial justice issue, and dare I say, the major racial justice issues of our time.
Yeah, thank you so much. And really is I've been involved in provincial majority of my life from kid in middle school to continue to in this field. And one of the things that we must acknowledge is that over the past 50 or 60 years, there have been historic levels of progress that have been made in this one. Smoking rates, particularly, have historic lows to the point where now, when you ask do you smoke? They say smoke what, right? Because the smoking tobacco have, declined so significantly. But like many things, that progress has not been evenly distributed. And we know that in the Black and brown community, in to community and Native American communities, those numbers still remain astronomically high. And some of the people are also by design because that's what makes it social justice issue. It is not just that our neighborhoods are inundated with tobacco advertisements. It is invested by the tobacco. There's no mistake. When you pull up to a gas station, a corner store in our neighborhood, and before you get out of the car or before you greet with um, walls and walls and walls with all advertising. That when you walk into that same safe, that if you're in there to get a bottle of water, when it's time for you to check out, that what you will be looking at is a power wall filled with tobacco advertisements, incredibly discounted, cheaper in Black neighborhoods than they are in other neighborhoods, because the tobacco industry has decades of well thought out investment, not social justice work, but death and disease. It's not really proud, of the progress that's been made. It's been made because of organizations like the Campaign for Tobacco for Kids and the Center for Black Health and Equity, and even the African American Tobacco Leadership Council out of California, which has done some really incredible groundbreaking work over time. But it is a racial justice issue, it's a social justice issue, and I'm proud even that you work about the CP. Frankly, my fingerprints are on that because at a time when one of my good friends, who is also a pastor, was then the youth and college director, senior leadership position with the Tobacco Prevention Organization. We got together and made introductions of our respective CEOs, thinned out some of that ice because historically the tobacco industry had even opted our civil rights organization in the ACP was giving millions and millions of dollars to them, to clergy and to elected officials, co-opted our leaders, co-opted put in for it, nothing but death and disease. Still today, in spite of all of that historic progress that we have made, 45,000 African American people, Black people, die each year in this country because of a tobacco-related illness. So we have got our work out for us. And that's why conversations like this are incredible.
Continuing to play the game of connect the dots, we want to connect the dots between social justice and our social emotional health. So I want to go back to Monroe and ask you to talk about some of the factors contributing to Black men feeling relegated to a very short range of emotions, right? Love, right? How can Black men that are streaming this right now, folks that will watch snippets of this on social media, how Black men begin to give ourselves permission to feel a wider range of emotion as opposed to reaching for a cigarette or a smoke.
One of the things is really going back to the environment in terms of what is validated, what is socialized. So when you mention those kind of main emotions for us, think about it, what is validated in terms of anger and depression, right? So the more you can you can exert dominance, the stronger you are. You are a strong man, and it is these tropes or it's these narratives that can validate that we're going to access all the time, not going to access the wide range of emotions that we all experience. We are human. We talk about lust, we talk about the hypersexualization of men going all the way back, talking about racial, the black book, right? So really kind of reducing us to our member, reducing us to an act really entice us to just go to these places and spaces. So I think one of them is creating and this is again, I talk about accountability, not just for the individual, but for the community as well as the individual, to allow space for an individual to feel, to express, to exert, to explore a wider range of emotions, right? Part of that is psychoeducation, right? So being exposed to vocabulary that goes beyond these three. So if we talk about I'm feeling dejected, or I'm feeling frustrated, or I'm actually feeling embarrassed right now. When we talk about the aggression or the anger, sometimes that actually emanates from being embarrassed. But who wants to say I'm embarrassed like man today? Because what does that imply? What does that imply? That I was not strong enough or to hold my own, that I allowed someone that type of access to me. So those are some of the things that I really do encourage my clients who are struggling with expanding their range, first their knowledge, and then creating a space in the therapeutic environment that says, here, we're going to ask the question why. We're going to go deeper. I really do appreciate hearing a physician asking the why. This is what I love about being a mental health professional, because so many instances we pathologize the behavior, we demonize the behavior, we never ask the question why. And in the why is where we can actually help create sustainable change. So, yeah.
I think that's great. Great, yeah. I got this. No, and I really appreciate that as model sharing, you know, in asking for it, in demonstrating compassion, and not judging it. And, you know, if you're in a doctor's office or a therapist's office to do that, these are tools that they're offering us that we can do at the kitchen table. We can do it in the barbershop. You know, take a run with somebody or what have you. Carry with us wherever we are. Dr.
Howard University is my institution.
All right.
I also
HU. Oh, you already.
I'm going to with that with who may be attempting to express something new. It's going to be a little messy. So I like to let people know, because sometimes people think like going to therapy and accessing my emotions and all this kind of stuff is going to be an overnight fix. It's going to be, actually, therapy is hard. Therapy is hard. Therapy is messy. Therapy hurts, right? Because you are accessing spaces you have deliberately or have enticed to suppress or to ignore or to from. So I always like to just prepare people to let them know that this is a journey, this is a process, but on the other side of that, and for me, healing is not a destination, it is a continuous journey. There are levels and indicators of healthy, right? And for you to experience, to have some of that, you know, I want that for everybody else, right? So I'm going to encourage you to do the work, to lean in, and you're going to need to cling to spaces. You can find other spaces that are going to support through the process.
Finding places and spaces where we work that can support us. Dr. Otalora, you mentioned this a little bit, but I sort of tease a little bit. There's many all the folks streaming here. So talk to us about access to cessation services and how that's got to be a part of the plan, even when it comes to eliminating cigarettes. What can we do to make cessation services available to every single Black person that wants to quit smoking?
Thank you very much. That's very, very critical. The first thing is to raise awareness, to let people know help is available. Most states now, when it's now, services there to provide resources to help you. It comes with a variety of formulations. You know, some people like the gum, the patch, different kinds of nicotine replacement therapies. However, major barrier is some people just don't know. And when they do know, do we follow up to encourage them to actually seek those services? So one of the things that as clinicians encouraged to do is that every visit. But again, we have to go beyond just encounters we have with people in the community. How do we spread that awareness through different media outlets, through different channels, obviously social media and advertising in the community and things like that? Those kind of outreach activities have to be done. We really have to replace that wall that you described in convenience store, a different kind of wall, one that represents resources, access to tobacco use. That's really, for me, that's where it starts from. Educating people, raising awareness, letting them know that there is help, and most instances help is free for some, sometimes 6 to 8 weeks, after which hopefully the individual insurance support their cessation
For that, it's free for a little bit, and so we have the resources, and I'm sure folks can do a campaign for tobacco free website and get connected to services. Services are available. We're going to open it up for Q&A. And this includes folks that are streaming and folks that are right here in the room. But before we go down the line, 60 to 90 seconds, what can Black men and those who love them, who love us, what can we do to try and improve our health? If there's one thing, a lot of, but from your vantage, where you sit, one thing we can do to improve our health, to elongate our longevity, to disrupt the injustice that we see in longevity. There's one thing that we can do. We want to start there on the end and work our way over here, Clinton.
Okay. I think open and honest conversation. I mean, we have to talk about it and be comfortable with talking about it with wherever we are, and not just in the doctor's office, not just in the barbershop. Wherever we are, we have to be comfortable and making connections like our program, Men Take Care. That's a program in which we encourage awareness. Right? So we want men to be comfortable with people talking about getting accurate information that applies to them. And my new term now is let's be real. Real being relevant, engaging, accountable, legacy.
Say it again. That was quick.
Let's be real. Relevant, actionable, relevant, engaging, accountable, and legacy. Okay? And if you want to get more information, and I hope I don't get in trouble for saying this, but we actually have a meeting conference at Howard University on this coming Saturday, and that's the title, from one brother to another.
All right, now.
Everyone is invited.
Oh, breaking news. Thank you, Clinton. Thank you. Reverend?
Yeah, I would add to that and really endorse it as well. My one thing would be to tell your story. We know that even in the faith tradition, there is a lot of value that is stored in your testimony. Right? And we also know that a lot of people have a lot of questions, and we don't always know how to verbalize the questions. But when we create a culture of being able to tell our stories, share information that relates to our journey of health, whether it's mental health, physical health, spiritual health, or otherwise, it can in turn help other people who are simply struggling in silence or looking for a set of resources that they may not even know to tap into. So my encouragement to everybody, particularly Black men, be more intentional about sharing your story, because you never know how good experience, which you've conquered, even what you're going through, can be a beneficial situation to help somebody else.
Mr. Watkins.
I got a lot of thoughts, but I would say I'll go at it from a different angle, advocating for, I would argue, controversial. And that's controversial because some people don't believe in that. But when you think about the notion of just barriers to access to healthcare in our community, it is very tangible. Quick example, after the killing of Mike Brown, the DOJ commissioned a study, and what they found was that one of the issues permeating for the Mike Browns in this community, for the young people in this community, that they did not have access to healthcare. I'm talking doctors, nurses, anybody. And so from that report, a free clinic was built and placed on Mike Brown's high school campus. And some people are like, wait a minute, I don't get the connection, but the dots are connected. And so I would argue free universal health care. Black man, woman, child should be advocating for that come hell or high water as a part of the model that we need to see liberate our communities.
Because a big part of what you're talking about when you say universal healthcare info from the up and neck down. Sometimes when people talk about universal healthcare, they think about it first through the neck down, right? Especially coming out of the pandemic. Now that healthcare from the neck is so incredibly important. Dr. Quartelai, what is your opinion?
I have to give you two. I have to give you two.
All right.
The first one, if you to inspire one black male child to medical school, become a doctor, preferably become a primary care physician, you'll make a huge difference in black men's health. So if you can go out there today, buy a white coat, buy a stethoscope, you got a young black boy, and tell him you can do it, hang in there, I believe in you. In 10 years' time, I want to say to you, Dr. Jackson, okay, make that boy believe and support him, and then get NAACP to pay his tuition. So that's one. That pipeline of minority black male physicians is critical. The second one, again, in difference to President Obama, you gotta vote. Go out there and vote. So there are also political determinants of health. Where you live, the leadership of your state, the laws in the state determine your access to resources. In some cases, can actually determine how long you live. So please go out there and vote. I can state how you should vote, but I mean, I'll leave it up to President Obama.
Oh, okay. Mic drop. Mic drop, everybody. Thank you, Dr. Quartelai. And now to bring us home, Monroe, what's your one thing?
Yeah, I have one for the community, or the one who loves the black man, and for the black man himself. And the one for the community is to learn to create space. That can be physical space or emotional space for a black man. Create space. It doesn't mean you have to be a licensed therapist. It doesn't mean you have to be a pastor. It doesn't mean you have to be a healthcare physician. It just means that you are creating space for another human in your humanness, right? Creating space also means that you are suspending judgment, and there is compassion and there is love that is going forward in creating that space. And then the second thing for the black man, I would say, learn to prioritize your mental health. And the way that we do that, because there's a lot of competing priorities. You got a lot of things that you are trying to figure out at the same time. So I encourage my clients or anybody that I come in contact with, if it is starting with 5 minutes or 10 minutes out of your day to do something that prioritizes your mental health. So if it's meditation, if it's breathing, if it's walking somewhere, if it is just taking a moment to be quiet, if it is reading something that replenishes or restores you, I want you to start small and create a consistent practice so that as you grow and develop, that thing will grow and develop with you.
Great. Thank you for that. Thanks to all of you. Let's give them a name. Double click on all of that. If there's one thing I would add, be gentle with yourself. Be gentle. You know, the world can be rough. The world can be rough on us as black men. And so, again, I want to invoke the spirit of Willis Edwards, who taught us to do what we can from where we are with what we have. So with that, we want to transition to Q&A from the audience that is here in the room and also the audience that is streaming live. We are anxious to get your questions. And so, Camille? Do we have a question? And look, I also double, not just journalist, I'm a professor. And so, you know, I'm not afraid to ask you all questions in the audience. And so, what did the Forever Queen of Rock and Roll, Tina Turner, say we could do this nice and easy, we could do rough? Right? And so what questions do you have for our distinguished panel?
Hello, my name is Nii-Quartelai. Just wanted to thank you all for this amazing conversation. It's been really insightful. My question is, do you believe that there is a stigma behind men being conscious about their health? And how does that contribute to men being willing to like seek out help within their communities?
Dr. O'Tlorin, you want to take the first stab at that?
Sure, I'll go ahead. So I wouldn't necessarily say that it's a stigma. I don't think men are perceiving awareness of their health as a stigma. I just think that unfortunately it's been relegated to the background of a lot of issues that they are facing. So it's not priority. You know, going in for your annual physical or going in to have a discussion with your primary care provider is not something that they think about often. It's not something that they prioritize. You know, I mean, they feel fine. They want to go about living their lives. However, there are benefits to having those conversations. Make sure you're up to date on your vaccinations, your screenings, even being able to serve as a resource. You come in, you talk about issues that pertain to your physical health, talk about your mental health, and also challenges at home. You know, do you need help to find a job, housing, things of that nature? Yes, you can discuss those issues with your family physician as well. And some of us have resources that we can provide you or at least direct you to community-based organizations that can help. So the issue really is more of, can we raise a level of awareness so that they see the benefit now and hopefully they'll be able to set time aside to have those encounters.
Richard, just as a follow-up to that question, because it kind of hit my ear a little bit differently. So let's talk about prostate health for a moment. I would argue, at least among a lot of folks I talk to, that there is some stigma around getting your prostate checked, right? And there are some folks that read into that themselves as, well, my prostate check, does this, say something that maybe I don't intend to say about my sexual orientation, right? I mean, like, we're keeping it real, folks, right? And so I think when it comes to certain health checkups, there may be some stigma around it. So, for example, when you get your blood drawn, right, and your doctor's asking you, all the things, and you're checking all the boxes in terms of, what lab tests they're going to do, sometimes people are shy about saying, yeah, I also want to check for HIV. I also want to check for chlamydia or for this or for that. And so, I think sometimes there are unspokens that we carry with us in the room. And so that's part of how your question hit me. And so I'm curious, as the person that's in the room, right? Sure. Do you see those things show up and how do you manage them?
Yes, they do. But part of my job is to help that patient, that person, feel comfortable enough to have those conversations so that I don't come across as a barrier to that person receiving the care that they need. So sometimes, depending on, for example, this happens often, patient schedules an appointment, they're coming in for a cough, and you get into the room, you're discussing, you're about to leave the room, and then the patient raises other issues for why they're actually here. That happens quite often. And part of our job is to pause and listen, and then make time to address that particular issue. So it does happen, but the onus is on us to create an environment where we can actually have this conversation. And part of what we also do is do some of these tests as routine, so that the individual has to opt out. Is it okay to perform decent HIV screening, syphilis screening? Would you like me to go ahead? Some will say, no, doc, you don't have to do that. I'm monogamous. I don't have any concerns in that area. We can let that go right now. And someone say, yes, glad you do so. But someone will say that I had this test done 3 months ago, but I want to do it again. I have a new partner, and I want to be screened again. So again, I put the onus on us as practitioners to create that environment where these conversations take place routinely.
Yeah. And I have to say that, bringing that in kind of goes back to what I was kind of some of my opening comments about the accountability that the Black community has to take. We talk a lot about what the dominant culture is doing to us, but we don't talk enough about what we're perpetuating within our community. And the demonization of the LGBTQIA plus population that happens within the Black community, within some of these historic institutions, creates these stigmas around health, right? That it is so now taboo to have you to be checked for a real and relevant potential, disease or something that because the stigma is so bad and the demonization of a particular marginalized population within our marginalized population, that gets perpetuated over and over again and creates these barriers and these ripple effects. So I tell people, homophobia, transphobia, all of that affects all of us. So if you think it's just affecting one population, it affects all of us because it creates these boxes that we can't get out of. So when I was talking about creating space for a man, create space for him to be all of who he is, or to be able to explore all of who he is. And it does not have to delineate or depict whatever, right? It is human function, human being.
And I actually like to add to that as well. I mean, I think that's part of it. In what I said earlier in terms of community engagement, you have to go out into the community to address some of these issues. So, I work closely with Dr. O'Delore, but my focus is being out in the community before these men get to the doctors. So how do we have to get them to the doctor first? So we have to go out and address some of those issues by meeting them where they are, first and foremost. And with and again, I hate to keep going back to the Men Take 10 program, but that's essentially what we do, because the program started over 20 years ago and the focus was just prostate health. But now we've kind of transitioned to overall men's health. Because one of the things that I noticed when I started with the program is that we were doing great with getting men to come into Howard for prostate cancer screenings every year, right? So but being at a hospital, the thought occurred to me, well, what if we introduce other health services to them at the same time? Men loved it. So going out into the community and kind of understanding, okay, what are your needs? Okay, I talk with you about prostate cancer, and a lot of men kind of draw back and say, no, I'm good. I don't need to do that. But then when you engage them and say, okay, well, these are your risk factors. These are things that you can look for now before you have a problem, because that's what screening is, looking for problems before they become problems. So you have to help them to understand what they're looking for or what to look for before they even get to the doctor. And the doctor will be the part 2.
Right, the doctor's the sequel. Question from the audience.
Hello.
Hello.
Hi, my name is Angelo Neal. I had a question for you because we talked earlier about how sometimes a lot of the safe spaces for Black men in our community, barbershops, churches, are not really safe spaces for all of us. So I'm asking the question to you, what safe spaces do those people have, or how can they find them if the regular ones aren't really for everybody?
Thank you for asking that question. I want to start by saying that I am fortunate to be alive to see that there's an emergence of more spaces that actually do affirm and include and celebrate, right, a wide range of spectrum of Black men, right? So that includes barbershops, that includes, I was a member of a church in Harlem who participated in Pride every year and who explicitly affirm the LGBTQIA plus population across the pulpit. So there are spaces that are emerging in the Black community that do actually see us, affirm us, and celebrate us, run by us, doing big things, right? So I would say, now what I will say to you is that most of those are in these, like, the DCs, the LAs, these urban, spaces. And so I do have a concern for my rural brothers and sisters who are out there and not having access to really spaces that have more of an open view, open mind, and are looking to create more spaces. So if you're in that situation, right, I say if it starts with one person, if it starts with one safe person. When I work with young people who are really exploring their gender identity and expression or their sexual orientation, it is not safe for all of them to actually come out. And that's real, right? Because we're talking about homelessness, we're talking about physical, emotional threats to violence. So one of the things that I start with is there one person, whether that be a friend, whether that be a caring adult at their school or somewhere or in their community, that they feel safe enough that they can talk to, right? So when we talk about that, it is really starting with, if it's just one person in creating that community and creating a safe space, then you can expand from there as you develop and grow in your confidence in who you are, who you want to be. So I try to not limit it to these large places, but saying, is there one? Mm-hmm. Is there one that is creating a space for you to be who you are? And let's start there and let's expand and grow.
And is there a website? Like, we know that since the pandemic, there's been an explosion in terms of telehealth services, and this question is not just for Monroe, but, for folks on the panel, is there a website? Is there a place where you would direct people where there are culturally competent, culturally aware telehealth services that may be available to our brothers and sisters and siblings that may be joining us via live stream? And for the folks here in the room, where can they go? What services are out there tailored to Black folks, particularly Black men?
If I can say something as a representative of
an institution that has not always, I like to talk about the good that churches do. I also acknowledge that there has been a level of harm, a significant level of harm as well. I'm also, first of all, I'm proud of my personal track record. I'm not your grandfather's preacher. I'm a learned man. All right, so I know what the scripture says. And even going back to what we shared earlier is the importance of telling our stories and making sure that we're being very open and very honest. I wanted to bring up as a point of reference again, though, the Center for Black Health and Equity, because I just recall just a few months ago, we held a symposium in Oakland, California, and had a blast in Oakland. And part of our programming, because we want to be, able to speak to all the many facets of Black folks. One of the things that we did, one night was working with the local community there to have, a drag show that was a part of our programming nationally. And as an ordained elder, that was not my first one, right? And so, I think that it is important to be able to not just, and you were speaking specifically to services, but I can speak to some of the programs that we offer and that we promote to make sure that people see themselves in the work that we do so that they can be sure that when we speak, we really are trying to speak for and to and as a benefit for all people, because I think that absolutely everybody matters. And we have to do, those of us who have some level of privilege and some level of power must do the hard work to learn from people, to hear their stories, and check ourselves whenever we need to do so.
Appreciate that.
There, in terms of mental health services, I was just trying to pull it up. There is a network. There is the Queer Therapy Network. So if you just type in Queer Therapy Network, you can search for affirming individuals there. And then also, even if you use some of the traditional sites like I'm listed on Psychology Today, which is a popular site where people will discover, there are boxes that you can check, right? So just like you can say what type of insurance, if you're looking for a Black male LGBTQIA plus identified or ally, you can check all that and it will actually pull up individuals, and you can search it by locale, geography. So you can find individuals locally who check those boxes. So there are some resources, even on some of the standardized sites.
What I love about this conversation is that, yeah, we're talking about tobacco, but we understand that there are root causes for why people reach for cigarettes, right? And you can't just start with the don't smoke cigarettes and ignore all the other stuff, right? And hopefully it's those insights that everybody in the room and all the folks that are streaming have gleaned and have added to your toolbox, insights, food for thought. Any additional questions in the room? Valerie, did you have your hand up? And I remembered your name. My Haitian brother right here.
Hello, everybody. My name is Valerie Jean-Jacques. I am a sophomore rising junior television and film major at Howard University. And I wanted to ask all of you as professionals in different fields about men's mental health, what do you think that Black men as a collective could do to normalize and destigmatize the effectiveness of therapy for mental health?
Well, I will lean in, and it's because you lifted up what you're learning, if you will, at your institution. So we have a Hollywood Bureau that produces the Image Awards. And it's a part of our framework that the images you see are shaping our reality, not just in terms of public policy, but culture. And so we think about that space when you're talking about mental health, not in a negative, but mental health should be a positive framework. We all should be mentally healthy. We are looking at a range of inputs. And so how are television shows and movies actually characterizing mental health as a thematic, especially in the Black community? We actually have a CBS deal where we buy and sell scripts. And so we're also looking at what does it look like to shape narratives through that enterprise. And so I would argue one slice of it, given what you're learning to do, if you will, is how do we make sure that the images and the narratives in popular culture are actually speaking to what we want our community to look like as opposed to what it is, because that is a part of the nexus around public policy, advocacy, and community engagement. It's not the only thing, but I think it's a big part of how we turn the corner. When the young lady asked about young, Black men, stigmas around health, there's an athlete image that's burned into our brains. Everybody wants to be Jordan, LeBron, etc. My dad bought me a t-shirt with Michael Jordan smoking a cigar when I was a kid. So when you start to think about it, it's an image. What does that mean for us, and how do we actually start to control more of our images and narratives is one of the ways I would put on the table that speaks to what you're asking.
And also I would say demystifying this whole therapy, right? Like therapy, because for a lot of people, one, that's a white thing, right? So we have to start to address that, right? And debunk those things and say, no, actually, there are clinicians who have been trained, who are from the community. I was just talking to somebody over here. We were just talking about like the importance of having someone who is real in these sessions. So it's not me. I don't have a couch in my office, right? So we here, we talking, and this language and the way in which I'm engaging with you. So like, how you doing today? What's good? Like, so what happened last week, right? We're having a conversation. So really starting to like break down this like really sterile experience. One of the things, the private practice that I'm part of, we do mental health on my block. So we go to communities around Montgomery County and also PG County, and we actually demonstrate, we do mock sessions in front of folks to just really kind of normalize what a conversation can look like in a therapeutic setting. So I think that's the other thing too, is like, take away the whole couch and like, I'm not real and I come in here and act like I don't have any problems. And sometimes I've wept, I've cried in a session with my client because I was maybe overwhelmed with like, I was so happy about what was happening, the progress that they had. And because I was able to do that, man, it creates that therapeutic bond just keeps building and building and building. So it doesn't have to be this sterile experience.
I would encourage folks to be aware of your media diet, particularly your news media diet. I think riffing off of Jamal's point, we have to be more conscious about what media we affirm, what media we put out into the world, right? What we're projecting. And sometimes, folks will read the headline and just retweet or repost and never read the article, right? Never watch the video or the whole video, right? And so, that perpetuates, I think, a low level of consciousness that can show up in lots of different ways when it comes to our individual health, when it comes to our community health, when it comes to our civic engagement and beyond. And so if there was one thing I would offer in response to your question, it would be that. Anybody else? All right. Well, we want to thank our panel. Thank our panel. Weren't they incredible? Brought their A game and then some. We want to thank all of you for being here. Thank you again to the Campaign for Tobacco-Free Kids for organizing this and bringing us here. We want to bring one of your fearless leaders right back to the mic.
Thank you, Dr. Quartey, and thanks again to this amazing panel for your very inspirational stories and your experiences. I think everybody benefited from it. The things that I would take away, have that annual physical. If you smoke, quit. Be your own, as a Black man, be your own healthcare champion. But we also need our policymakers to be champions for us as well. So if there's anybody from the FDA even in the room or streaming, we're looking for you to finish that menthol and flavored tobacco rule as soon as possible so we can keep 85% of the folks who smoke menthol are African American. As you heard, 45,000 preventable deaths in the African American community from tobacco-related disease every year. We can stop that. FDA, you have the power. We're waiting on you. This was an amazing conversation beyond the barbershop. So thanks, everybody. Take care of yourself and have a great night.
Thank you, Sarah. Thank you, guys.